Asa Hutchinson told members of the Arkansas Municipal League that when it comes to the Omicron variant here in Arkansas, that the worst may not be here just yet. The president of the Arkansas Center for Health Improvement says he will not be surprised if we soon see 10,000 new cases in a single day. And over at UAMS, they're already seeing challenges that could soon be the same challenges that hospitals across the state experience.
The other thing that we're seeing that I'm sure you're starting to experience and we're all going to face over the next month are the number of our workers that are in quarantine.
Dr. Susan Smythe is dean of the UAMS College of Medicine. She says hundreds of healthcare workers couldn't show up to work today due to COVID-19 infections or exposures. And she says,
we're anticipating that pretty soon we're going to get to 20% of our workforce will not be able to come to work.
Nationwide shortages of monoclonal antibody treatments are also causing shortages in Arkansas.
Only one of the monoclonals work, so only the Sotrovimab works with Omicron. We are anticipating that our stock of that antibody will run out today, and we will not get any more for a week.
Our healthcare system is being stressed. It will not surprise me if we break 10,000 by the end of the week. Each one of those 1,000 new cases generates a certain number of new hospitalizations.
We just got to get through January.
Governor Asa Hutchinson says right now, Arkansas is seeing less than half the number of new COVID-19 cases per 100,000 residents compared to the top states with new infections.
What that tells me is that this is extraordinary. We've had 3 or 4 days of record number of new cases, and we're still not where many other states are and what they're going through.
Hutchinson says he met with White House leaders about when active cases could drop, but for now he's skeptical.
They believe that at the earliest it could start going down January 9th. That sounds a little early to me, but it could be going down by January 15th.
To help with at-home rapid test shortages, the governor says he hopes some of the 1.5 million tests that were ordered by the state can be distributed for free starting early next week.
Hope to have at least a large portion of these in tomorrow, but this is a supply issue with the federal government ordering 500 million. That is a real demand challenge across the country.
Hospitals in Northwest Arkansas and here in the River Valley say they're also seeing difficulties with staffing shortages as well as securing monoclonal antibody treatments that's in high demand across the nation. Now tonight at 6, we'll hear from a local doctor about what he's seen firsthand in our local emergency rooms. Live in Fort Smith, Brett Rains, 4029 News.